Disclaimer: the following podcast episode is for educational purposes only and should not be taken as medical advice. Always consult with a qualified healthcare professional before starting, stopping, or changing any treatment or supplement, including peptides such as Exenatide. Today we're going to take a deep dive into Exenatide, a peptide that has made a name for itself in the world of metabolic health, weight management, and diabetes care. You may have heard of it in brand-name drugs like Byetta or Bydureon, but at its core, Exenatide is a synthetic version of a naturally occurring peptide originally discovered in the saliva of the Gila monster lizard. That's right, a desert reptile helped pave the way for an entire class of medications that changed how we manage blood sugar and weight. Exenatide is a glucagon-like peptide-1 receptor agonist, often shortened to GLP-1 receptor agonist. What does that mean? Well, GLP-1 is a hormone your body naturally releases after eating. It helps stimulate insulin release, slows gastric emptying, and signals satiety, which is the feeling of fullness. Exenatide mimics this hormone, binding to the GLP-1 receptor and essentially amplifying the body's natural mechanisms for controlling blood sugar and appetite. Let's break that down in simpler terms. When you eat a meal, especially one containing carbohydrates, your blood sugar rises. Your pancreas needs to release insulin to move that sugar into cells for energy. In people with type 2 diabetes, this process is impaired. Exenatide helps by prompting the pancreas to release more insulin when it's needed, but not when it's not. This targeted effect lowers the risk of hypoglycemia compared to some older diabetes medications. Another interesting aspect is how Exenatide delays gastric emptying. That means food leaves your stomach more slowly. This not only helps blunt the rise in blood sugar after meals, but also makes you feel full longer, which is one reason GLP-1 receptor agonists like Exenatide have become popular in the realm of weight loss. People tend to naturally reduce their food intake without feeling like they're starving themselves. Now, how is Exenatide used in practice? There are two main forms. The original version, Byetta, is a twice-daily injectable. Later, Bydureon was developed as a once-weekly extended-release version, making it far more convenient for long-term use. Both forms are delivered via subcutaneous injection, typically in the abdomen, thigh, or upper arm. In clinical studies, Exenatide has consistently shown improvements in A1C, which is the long-term measure of blood sugar control, as well as modest weight loss. Many patients experience a drop of about 1% in A1C, which is significant for diabetes management, and an average weight loss of around 5 to 10 pounds over several months. These numbers may not sound dramatic, but they make a real difference in metabolic health, cardiovascular outcomes, and overall quality of life. Speaking of cardiovascular outcomes, newer GLP-1 receptor agonists have been specifically studied for heart benefits, but even Exenatide itself has demonstrated some protective effects. Reducing blood sugar, lowering weight, and improving insulin sensitivity all contribute to reduced strain on the heart and vascular system. Of course, like any medication or peptide therapy, Exenatide isn't without its drawbacks. The most common side effects are gastrointestinal, including nausea, vomiting, and diarrhea. These tend to be worse when first starting treatment, but often fade as the body adjusts. Some patients also report injection site reactions, particularly with the extended release formulation, where small nodules under the skin can appear. Rare but serious risks include pancreatitis, so this peptide must be used with caution in anyone with a history of pancreatic disease. What's fascinating is how exenatide paved the way for an entire generation of GLP-1 receptor agonists. Drugs like liraglutide, semaglutide, and dulaglutide all followed, many with improved efficacy or dosing schedules, but exenatide was the trailblazer. Without it, we might not have today's highly effective peptide therapies for obesity and diabetes. Now, let's step back and talk about exenatide in the context of peptide science. One of the reasons peptides are so powerful is that they work with the body's existing signaling systems rather than trying to override them. Exenatide doesn't force insulin release all the time. Instead, it enhances insulin secretion only when glucose levels are elevated. That makes it far more physiologic and, in many ways, safer than some older treatments. Another point worth mentioning is how exenatide has been studied in neurological conditions. Because GLP-1 receptors are also present in the brain, researchers have looked into exenatide for neuroprotection in diseases like Parkinson's and Alzheimer's. Early studies have shown promise, suggesting that GLP-1 receptor agonists may help protect neurons, reduce inflammation, and improve cognitive function. While it's far too early to call exenatide a treatment for these conditions, the research highlights how one peptide can have effects far beyond its original purpose. The journey of exenatide also reminds us of the importance of natural sources in drug discovery. Who would have thought that the saliva of a venomous lizard could inspire a class of medicines that improve the lives of millions of people worldwide? It's a perfect example of how nature often holds the keys to innovation and how careful scientific exploration can unlock those secrets for human benefit. From a practical standpoint, people using exenatide often notice changes within weeks. Blood sugar levels begin to stabilize, weight begins to shift, and energy levels improve as glucose control becomes more consistent. For many, this is life-changing, especially for those who struggled for years with uncontrolled diabetes or difficulty losing weight despite diet and exercise. That said, exenatide is not a magic bullet. It works best when combined with lifestyle changes like healthy nutrition, regular activity, and adequate sleep. Peptides are tools, and like any tool, their effectiveness depends on how they are used. Now, let's spend some time imagining what the future might hold for peptides like exenatide. As researchers continue to refine delivery systems, we may see oral formulations, longer-lasting versions, or even combination therapies that pair exenatide with other peptides or small molecules to maximize results. Already, there's excitement about dual and triple agonists that target multiple receptors at once, such as GLP-1 and GP, or GLP-1 and glucagon. These newer compounds aim to deliver even greater weight loss and metabolic improvements. But again, it all started with exenatide. As we move through the next decade, it's clear that GLP-1 receptor agonists will continue to play a central role in managing both diabetes and obesity. Exenatide may no longer be the newest or the most powerful, but its place in history is secure. It was the proof of concept that opened the door, and it remains a reliable option for many people today. So what should you take away from all this? Exenatide is more than just a drug. It's a story of discovery, innovation, and the incredible potential of peptides. It shows us how biology, chemistry, and even unexpected sources from nature can come together to create something transformative. It also reminds us that science is never static. What starts as one therapy often becomes the foundation for an entire field of progress. Disclaimer: this podcast is for educational purposes only and should not be considered medical advice. Always talk to your healthcare provider before making any changes to your health regimen, including peptide use. Thanks for listening, keep learning, and stay curious.